Why your lower back feels stiff every morning. The hidden muscle most doctors never mention. Most people wake up with a stiff lower back and blame the obvious things first. The mattress, the pillow, their age, maybe a slip disc, and to be fair, sleep position and mattress support really can matter. Cleveland Clinic notes that lower back pain in the morning can be related to sleep position and mattress issues, while the NHS points out that back pain can also come from simple muscle strain, disc problems, or less commonly, inflammatory conditions like ankylosing spondylitis. But this is where the story changes. If your lower back feels especially stiff first thing in the morning and then eases once you start moving, the problem is not always the bones, not always the discs, and not always the bed. Sometimes the hidden issue is a deep stabilizing muscle called the lumbar multifidus. The medically honest version is more specific than the title. The multifidus is not the only cause of morning stiffness, but it is one of the most overlooked contributors to mechanical low back pain and spinal stiffness, especially when the back feels worse after rest and better once movement returns. Reviews published in 2024 and 2025 describe multifidus dysfunction as an increasingly recognized contributor to chronic low back pain, with changes such as atrophy, fatty infiltration, and abnormal muscle function showing up more often in people with back pain than in pain-free individuals. Here is the practical takeaway early, because most people should hear it before minute 10. The hidden muscle that best fits this title is the multifidus, a deep spinal stabilizer that helps control and protect the small joints between the vertebrae. If that muscle becomes underactive, poorly coordinated, or deconditioned, your back can start feeling stiff and guarded after hours of lying still. That does not mean every stiff morning back is a multifidus problem. It means that if you keep focusing only on discs and never on deep spinal control, you may be missing one of the most fixable parts of the story. Joe SPT Open notes that the lumbar multifidus plays a major role in protecting the lumbopelvic region and stabilizing the spine, while the recent PubMed review says treatments aimed at restoring multifidus function include motor control exercises and other targeted approaches. This is where people get fooled. They think pain only comes from structures that show up dramatically on scans, but low back pain is often more about control than catastrophe. The multifidus sits deep along the spine. You do not see it in the mirror. You do not feel it the way you feel a hamstring stretch or a calf cramp. But it matters because it helps the spine handle small movements cleanly. When that system is not working well, the back often compensates by tightening, guarding, and moving less smoothly. That tight wooden feeling many people notice on waking can be the body trying to create stability the hard way. The literature on multifidus dysfunction increasingly treats it as a distinct low back pain phenotype rather than a minor side note. And this is why morning is such a revealing time. Overnight, you have been still for hours. Even a healthy back can feel stiffer after prolonged immobility. But a back that relies too heavily on protective stiffness because the deep stabilizers are underperforming will often feel that difference more sharply. The person gets out of bed and says, "I feel 90 years old" for the first 10 minutes. Then they walk, shower, move around, and the back gradually loosens. That pattern does not prove multifidus dysfunction, but it fits the idea that rest is exposing a control problem, and movement is temporarily restoring flow and coordination. Cleveland Clinic notes that morning back pain often improves once people start moving, and Mayo says inflammatory spinal conditions also classically worsen after inactivity and improve with movement, which is why duration and the rest of the pattern matter so much. Now I want to be careful here, because not all morning stiffness is the same. There is a big difference between my back is stiff for a few minutes and then works itself out, and my back is severely stiff every morning for a long time, especially with buttock pain, fatigue, or other inflammatory symptoms. Mayo says ankylosing spondylitis often causes back pain and stiffness that are worse in the morning or after inactivity, and the Cleveland Clinic Journal of Medicine notes that fairly constant morning stiffness and nocturnal spine pain can be clues to inflammatory spondylitis. So the hidden muscle story is strongest when the pattern looks mechanical, not when there are signs pointing to inflammatory disease. That is also why the phrase most doctors never mention needs translation. Good clinicians absolutely know the multifidus exists. But in real-world patient conversations, what people hear most often is discs, arthritis, sciatica, posture, mattress. The deep stabilizer conversation is less common, especially outside rehab-oriented care. Meanwhile, the research world has been paying much more attention to this muscle. Reviews now consistently describe multifidus changes in chronic low back pain and discuss therapy specifically aimed at restoring its function. So the muscle is not obscure in the literature. It is just under-discussed in everyday explanations patients get. The second reason this matters is that morning stiffness is often blamed entirely on tightness, when the problem may actually be poor activation. That sounds backwards, but it happens all the time in musculoskeletal pain. A body part can feel tight because it does not trust itself. The muscles around it overbrace. Movement gets guarded. The system tries to create stability by reducing motion instead of controlling motion. When the multifidus is not doing its job well, the rest of the lower back often becomes the backup plan. That is why some people stretch constantly and still wake up stiff. They are treating the sensation, not the control problem underneath it. The multifidus literature increasingly links low back pain not just to weakness in the generic sense, but to altered neuromuscular control. And this is where sitting enters the story, even if the pain only shows up in the morning. Long hours of sitting are not kind to the lower back. Newer biomechanical research shows prolonged sitting increases lumbar disc pressure, reduces lordosis, and statically overloads spinal tissues. That matters because many people spend the whole day sitting, then go to bed, then wonder why the back feels stiff on waking. The night may reveal the problem, but the day may be feeding it. So the stiff morning back is sometimes less about what happened during sleep, and more about what your spine and deep stabilizers have been dealing with for the previous 16 hours. So what should happen instead? Not panic, and not endless random stretching. The more useful approach is to think in terms of reactivating deep spinal control and reducing the all-day pattern that shuts it down. The recent multifidus review points to motor control exercises as one of the main treatment approaches used to restore natural multifidus function. That means the answer is often not a bigger stretch, but better targeted rehab, the kind that teaches the deep stabilizers to switch on and support the spine again. And this is the part most people miss. When the multifidus improves, the goal is not to make you stronger in the bodybuilding sense. The goal is to make your spine feel less threatened by ordinary movement. Less morning guarding, less startup stiffness, less need for the body to brace every time you roll, stand, bend, or take the first few steps after getting out of bed. That is why this muscle matters so much. It influences how the back behaves in the small moments people usually ignore, and morning is full of those moments. One more thing matters here. Morning stiffness can also be associated with disc degeneration and spinal osteoarthritis, especially in older adults. Studies have found that patient-reported spinal morning stiffness is associated with lumbar disc degeneration. A newer work suggests morning stiffness in back pain patients may often reflect degenerative rather than systemic inflammatory processes. That does not weaken the multifidus argument. It actually makes it more relevant. Because in a degenerative spine, control and stabilization often matter even more. If the discs and joints are no longer as forgiving as they once were, a poorly functioning deep stabilizer becomes a much bigger deal. So if I had to reduce this whole topic to one line, it would be this. Your lower back may feel stiff every morning, not just because something is damaged, but because one deep muscle that is supposed to quietly stabilize your spine is no longer doing that job well enough. And when that happens, your body creates stiffness as a substitute for control. If the stiffness is brief, clearly mechanical, and improves as you move, the multifidus story is worth thinking about. If it is severe, lasts a long time, wakes you in the second half of the night, or comes with buttock pain, fatigue, eye symptoms, bowel symptoms, or a big loss of mobility, that is where the inflammatory back pain conversation becomes more important. The smartest move is not to assume one explanation fits everyone. It is to stop treating every stiff morning back like a mattress problem and start asking what kind of back pattern you actually have.